This is acute post-streptococcal glomerulonephritis. Everything you need to know about it is in the name. So the glomeruli become injured by an immune response in the body that's causing inflammation. And that immune response is usually after the child has been infected with group A beta hemolytic strep, which is what we see in strep throat and in impetigo. The risk factors are males more than females suffer from acute post-streptococcal glomerulonephritis. They're usually between 3 to 7 years. So if you remember nephrotic syndrome, this is an older age bracket. And they've had a recent infection with strep. There are other risk factors such as different autoimmune diseases like lupus, polyarteritis nodosa. Sorry, my dog is choking. He's always choking on something. Granulomatosis and Hinoch-Schönlein purpura, which is it's just a type of purpuric rash that we see in some kids. And another syndrome called Alport syndrome. All of these can lead to glomerulonephritis, but acute post-streptococcal glomerulonephritis happens after strep. These are the cues we're going to see in our patient. They're going to be very edematous. Their blood pressure is likely going to be elevated. They're possibly going to have crackles heard in their lungs because of fluid overload. They possibly have fever, lethargy, headache because they're swollen, they're malnourished, they're protein depleted, and they are dehydrated even though they are so swollen and puffy. They have very minimal urine output, and what urine there is dark tea-colored or cola-colored urine because there's frank hematuria and frank proteinuria. They also have abdominal pain. Everything, their lymph nodes, everything in their abdomen just gets really swollen. So they do develop a lot of pain. They will have vomiting and anorexia as well. Joint pain and a rash on the buttocks and legs is also common in these kiddos. So these are the diagnostic workups that we have to do when we are ruling out acute post-streptococcal glomerulonephritis. One of the first things we can do is a throat swab. Unfortunately, you kind of have to be in the throes of the strep infection for the swab to come back positive. And frequently in age groups 3 to 7, we don't get an accurate throat swab anyways because practitioners are too nice about it and they don't actually touch the back of the throat with the swab. So we get a more appropriate diagnostic evaluation if we do what's called an ASO titer, which is a blood test that looks for a recent strep infection, not a current strep infection, recent. And ASO means anti-streptolysin. These kids also, we're going to see that their BUN and creatinine is either within normal ranges or it's elevated. They're going to have elevated ESR, probably an elevated CRP, just literally because of all the inflammation in their bodies. And like I said, their urine is going to be frank blood, frank protein, and we're likely going to see hypoproteinemia on the blood work as well. So you're probably thinking, this sounds so much like nephrotic syndrome, but what I want you to pay attention to is that this occurs after a recent strep infection where nephrotic syndrome is usually idiopathic. They don't know what is causing it. This is a slightly older child, 3 to 7 years old, whereas nephrotic syndrome, they are 2 to 3 years old. They are going to have blood pressure changes with glomerulonephritis, and they don't always have blood pressure changes with nephrotic syndrome. They also do not have frank blood or tea-colored, cola-colored urine with nephrotic syndrome. They just have pale, frothy urine. Glomerulonephritis, it looks like a soda because of all the blood and protein in it. So the management of acute post-streptococcal glomerulonephritis is kind of just maintenance. We're trying to maintain their fluid volume without pulling too much fluid off of them at one time because that can lead to problems. We want to do it gradually. We want to manage their hypertension. We want to make sure that they receive albumin if they need it, but there's really no treatment other than giving antibiotics if strep is found. If strep isn't found, we're still going to treat them like they have acute post-streptococcal glomerulonephritis. All right, the medications that we use, you can see these are different than with our nephrotic syndrome patient. Our nephrotic syndrome patient, they're using steroids, they're using, if they're steroid resistant, the immunosuppressants. Here, we're just going to control the blood pressure and we're going to control the fluid, the edema, by giving them labetalol or nifedipine and giving them furosemide. And once the inflammatory response that they're having due to the strep has run its course and these medications were used, then we'll discontinue them and that's it. These are the actions or interventions that the RN is going to take. We're going to do frequent BP monitoring. So like this says, it's likely every 2 to 4 hours. While they are edematous, we're going to restrict sodium in fluids just like we would with nephrotic syndrome. However, here, depending on their labs and their vital signs, we might also restrict protein, phosphorus, and potassium. Because the glomerules here are actually inflamed and swollen, they're not necessarily bigger like they are in nephrotic syndrome, so they're allowing for things to spill, but they're not filtering blood appropriately, so a lot of the waste products like phosphorus are not being removed, and they're building up phosphorus and potassium in their super dehydrated blood. We don't do that all the time though, that's up to the doctor. Daily weights are going to be done on the same scale with the same amount of clothing. We're going to monitor their urine output and the color of the urine. We're going to do neuro checks because the hypertension that they can have frequently can cause encephalopathy and seizures. And we're going to let these kids rest as much as possible and give them age-appropriate activities that they can do literally in bed because they need to rest. And activity is just going to make them feel grody. It's going to make their joints hurt more. It's going to make them more lethargic and tired. So as much rest as we can give them. We are going to explain to family that we are not going to use NSAIDs at all. These are the complications of acute post-streptococcal glomerulonephritis. They can develop uremia and all of the problems that go along with that. and they can also develop renal failure. The seizures and encephalopathy, it's definitely a complication, but if we are monitoring the blood pressure appropriately and treating them appropriately with medications during their edematous phase, then they should not develop seizures or encephalopathy.